All right, we're going to turn now to the question and answer segment. And as you know, as I mentioned, we've had hundreds of questions submitted across the country on the web. So we'll start with some of those. And if you're in the audience, start to think of what question you'd like to ask as well. All right, so the first question comes to us from Brian, and he submitted it as a web question. Why are neurologists so reluctant to write consults for individuals who wish to be tested for indications of CCSVI in private clinics? The tests pose no danger, far less than Tysabri, which is the drug which can be very dangerous. The costs for the tests are borne by the individual taking the tests, since they are done in private clinics. Dr. Murray, that falls to you.
Yes, well, I can understand the question clearly. It's interesting, Tysabri, which does have risk, it's true. However, it also has a number of randomized clinical trials to show that it actually does have benefit. But it does have risk, and that's true. It isn't true, however, to say that the procedures don't have risk, because they are invasive procedures in most cases. There is an attempt to see whether or not external Doppler studies can be done, but the transluminal studies that were done by Dr. Zamboni and by many of the other clinics, and then the procedure itself does have risk. And we've already, I think, heard publicity about some of the complications that have occurred to patients from having the procedure. So the reluctance is an interesting one. And that's, I think, because physicians are not used to the idea of prescribing experimental therapies. And they know if they speak to their local radiology department, they're not used to doing these procedures, nor are they set up to do it. And very often they don't have the equipment that the very specialized units, such as the one in Italy, had to study. It was a vascular unit doing this kind of research. So you had two aspects. The local hospitals are not set up to do this kind of procedure, nor would they likely have permission from their hospital to do, again, an experimental kind of process. So I think the reluctance to some extent was about suddenly being pressured to give something for which there is not a lot of evidence, and then talk to the radiologist, who was very uncomfortable about the idea of doing the procedures.
Right, you can't have guinea pigs.
You can have, I hate the term, but you can have if you establish a protocol which says it's experimental, but this is the way we will do it. And when you do that, you have to go through an ethics committee. And the ethics committee, if it's going to be done in a hospital, will be looked at by the hospital ethics committee, who will evaluate why this is being done and the care and the protocol and the other things. You can't just go ahead and do those things.
Okay.
Now, you can set up a private clinic and do all sorts of things.
Our next question comes on the web from Francine in Quebec. Why is the MS Society of Canada only contributing a mere, these are her words, $100,000 per year for a total of 2 years toward research in CCSVI? What about the $62 million it has received through fundraising for research to find a cure? To me, quote, you are killing the study with this ridiculous amount of money. Again, from Francine in Quebec. Yves.
Thank you. This is a very important question. I think it's important to ensure that people understand that the $200,000 over 2 years per project is in fact per project. It's not the total sum that will be allocated. We have, quite happily, a good number of applications as a result of the CCSVI competition. In fact, we let good science drive the total amount of money that is going to be invested in CCSVI research, as we do in all of our competitions. The applications are currently being reviewed by a panel of experts from Europe, the United States, and Canada that include neurologists, radiologists, vascular surgeons, imaging specialists, who are themselves not applicants, so they're not in a position of conflict. And they will make independent recommendations about those applications that are good science. We will fund all of the proposals that are good science. And those announcements will be available on our website in mid-June. I think it's important to put this competition in the context of the entire panoply of the Society's research activities. The CCSVI competition is itself unprecedented. We opened a special request for proposals on CCSVI in November because our most popular competition has a deadline date of October. It had just closed, which would have meant, if we hadn't opened this competition, that the most natural way to seek funding to answer important questions, for instance, questions about what is the reliable way to image the blockage in the veins so that you don't get the false positives or false negatives. Those kinds of questions. And the size of the studies was determined by the Medical Advisory Committee of the Society to be appropriate. The reality is that all of our competitions are open to CCSVI business, if you wish. We did a special one because of the public interest. And it's important to acknowledge that the mobilization of people with MS in support of CCSVI research caused the Society to respond, because we wanted definitive answers quickly, and we couldn't wait till October of 2010, which would have been the next occurring natural timeline. But let me just give you another example. Before June, we will open the annual call for proposals for our most significant research projects. They're valued at actually between $4 and $5 million a pop. Those research applications require that a number of institutions come together and collaborate in putting an application forward. We've funded stem cell clinical trials, for instance, or research on the genetics of MS, where Canada has made very important discoveries. And that call is also open to CCSVI. So the Society's contributions to research, which are valued at more than $120 million over its history and at more than $10 million a year, have to be seen in the context of what appears to be relatively modest amounts. And I think it's for that reason that we need to make sure that we don't mistake the $200,000 per grant as the total sum of dollars that the Society will be investing in CCSVI research. I should also point out that the Society was first in launching a competition specifically for CCSVI research. And we're very proud that our American partner organization, the National MS Society, based in the US, mirrored our competition just after the holiday season. And we're actually doing the review together. The panel of reviewers who are the experts that are going to make these tests are doing it jointly across all of these applications drawn from the US and the Canadian competition. And together in mid-June, we'll make those announcements of the successful projects. So I would just invite you to stay tuned. And it's at that time that we'll be very pleased to communicate the totals of both the US commitments and the Canadian commitments to CCSVI research in this first competition. Won't be the last, because we look forward to other applications through our regular and many offerings. All of those are information about our various competition are available on the website.
Good. All right, we'll stay tuned for that.